Good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm one of several personal advisors here at MediGap Advisors. And I'll be your host today to discuss the ins and outs of Medicare Advantage plans, how they work, what you should know about them, and how they can benefit you. It'll take us approximately 20 minutes or so to go through the basics of what Medicare health plans are all about, how they work. If you stick with us until the end, you'll know more about them than the other 99% of Medicare beneficiaries out there. And more importantly, you'll learn how to get the most value out of your health plan year after year with our help. The information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime. So to avoid distractions, we'll go ahead and currently have the lines muted. At the end of the presentation, we'll go ahead and take some questions. And you can also use the chat box to type in your questions as you think of them. Now, due to Medicare's strict guidelines, this webinar is intended for educational purposes only, so we won't be able to address anyone's plan-specific questions or how one carrier's health plan works compared to another. However, we will be able to give you some exact instructions on how to go about doing that and get those specific types of questions answered if you do have any at the end of our session today. Lastly, I want to note that MediGap Advisors is not affiliated or endorsed by CMS, Medicare, or any federal agency or state organization. So with that said, let's go ahead and get started. We'll begin by asking the question, what is a Medicare Advantage plan? Now, Medicare Advantage, also referred to as MA plans, are health plan options that are approved by Medicare and are run by private insurance companies. They are a part of Medicare and are sometimes also called Part C. Medicare Advantage plans, or MA plans, are offered in many areas of the country by private health insurance companies that sign an annual contract with Medicare, who in turn pay these private plans for their members' expected health care. Now, MA plans provide, Medicare-covered benefits to members through the plan, and may also offer extra benefits that original Medicare doesn't cover, such as extra vision or dental services, to name a few. Keep in mind also that most Medicare Advantage plans have special rules that its members need to follow. With a Medicare Advantage plan, you'll receive Part A, hospital insurance, and Part B, the medical insurance, covered services through that plan. And as I mentioned a minute ago, some of those MA plans provide additional benefits as well. Many plans also include Medicare prescription drug coverage, also known as Part D coverage, built into the plan. And in some plans, like HMOs, you may be able to see only be able to see certain doctors or go to certain hospitals. As you might expect, benefits and cost sharing in an MA plan may differ from original Medicare. It is important to note that when you join a Medicare Advantage plan or other Medicare plan, you are still in the Medicare program, and Medicare pays these private health insurance plans for your care each and every month, whether you use services or not. You still have Medicare rights and protections, as you do with original Medicare, and we'll discuss some of these later in the presentation. Okay? In the event that the plan decides to stop participating in Medicare, you'll have the opportunity to join another MA plan or return to original Medicare. If you do join a Medicare Advantage plan, you must continue to pay the monthly Part B premium, and the Part B premium in 2015 is $104.90 for most people. But we don't yet know what that amount will be exactly in 2016. It's going back and forth through legislation right now. A few plans may pay all or part of the Part B premium for you, and some plans may be eligible, some people, I should say, may be eligible for state assistance based on their income. When you join an MA plan, there are other costs that you may have to pay, such as additional monthly premiums, deductibles, coinsurance, and co-payments. As I stated earlier, these costs may be different from original Medicare. They can vary from plan to plan, and they could be higher if you go outside the network. Let's talk about who can join. So these health plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, you must be entitled to Medicare Part A, the hospital insurance, and enrolled in Part B, the medical insurance. You must also live in the plan's geographic service area. And people with end-stage renal disease, otherwise known as ESRD, usually cannot join an MA plan or other Medicare plan. However, there are some exceptions. For example, an individual who develops ESRD while enrolled in an employer group health plan may be allowed to enroll in an MA plan when transitioning off of group coverage without a break between the coverage. A person who receives a kidney transplant and no longer requires a regular course of dialysis treatment isn't considered to have ESRD for purposes of eligibility. And to join an MA plan, you must also agree to provide the necessary information to the plan, agree to follow the plan's rules, and belong to only one Medicare Advantage plan at a time. You can join a Medicare Advantage plan either if you were when you first become eligible for Medicare during your initial enrollment period, which begins 3 months immediately before your first entitlement to both Medicare Part A and Part B, or during the Medicare Open Enrollment Period, which we're currently in. So that's the time that you can join the Medicare Advantage plans. It's also known as the annual election period. That's the period that runs from October 15th through December 7th of each year, with coverage starting January 1st. And you can only join one MA plan at a time, and enrollment in the plan is generally for a calendar year. Plans must be allowing new members to join, and so in some cases, plans may be prohibited from accepting new members if there's a CMS-approved capacity limit or an enrollment sanction is in effect. You may also be able to join or switch plans if any of these special circumstances that grant you a special enrollment period apply to you. For example, if you move outside your plan's service area, if you're enrolled in a plan that decides to leave the Medicare program or reduce its service area at the end of the year, if you leave or are losing employer or union coverage, if you enter, live at, or are leaving a long-term care facility, if you qualify for extra help, you do have a continuous special enrollment period, meaning that you can enroll or switch your plan at any time. And if you lose extra help status or eligibility, that's also another reason that you would have a special election period or enrollment period. You can also join or switch to a plan that has a 5-star rating, and receiving a retroactive notice of Medicare entitlement would also qualify you. Now, how do plans achieve the 5-star rating? Medicare does use information from member satisfaction surveys, plans, and healthcare providers to give overall star ratings to the plans. They get rated from 1 to 5 stars, and a 5-star rating is considered excellent. At any time during the year, you can use the 5-star special enrollment period to enroll in a 5-star Medicare Advantage or prescription drug plan, as long as you meet the plan's enrollment requirements, for example, living in the service area. You may also use the 5-star SEP to change plans from one time between December 8th and November 30th of the following year. And once you enroll in a 5-star plan, your SEP ends for that year, and you're allowed to make changes only during appropriate enrollment periods. Your enrollment will start the first day of the month, following the month in which the plan gets your enrollment request. Plans get their star ratings once a year in October of the past year. So the plans won't actually have the rating until January 1st, but will be assigned the rating in the October before that January 1st. Now, currently there's only a handful of plans throughout the country that meet that strict criteria. If you do belong to a Medicare Advantage plan or MA plan, you can switch to Original Medicare from January 1st through February 14th. If you go back to Original Medicare during this time, plan coverage will take effect on the first day of the calendar month following the date on which the election change was made. If you make this change, you may also join a Medicare prescription drug plan to add drug coverage. And coverage begins the first day of the month after the plan receives the enrollment period, or the enrollment form, I should say. You may not join another MA plan during this period. It's important to remember that any time you enroll in a new MA plan or prescription drug plan, it's going to automatically disenroll you from your previous plan. So our advisors are able to assist you in this process if there's something that you're interested in pursuing or have additional questions about. There are special trial rights for special enrollment periods available when you join a Medicare Advantage plan for the first time. You're eligible for this trial right if you either joined an MA plan when you first became eligible for Medicare at age 65, or were in original Medicare, enrolled in an MA plan for the first time, and then dropped MediGap which is Medicare supplement insurance. The trial right allows you to disenroll from an MA plan during the first 12 months and return to original Medicare. So you also have a guaranteed issue right to purchase a MediGap policy at that time. Now, there are 5 common types of Medicare Advantage plans. The first one is an HMO, or Health Maintenance Organization. In an HMO plan, you generally must get your care and services from doctors or hospitals in the plan's network, except for emergency care, out-of-area urgent care, or out-of-area dialysis. There's an HMO point of service. So some of those plans, you may be able to go outside the network for certain services, usually for a higher cost. That's called an HMO with a point of service option. There are PPOs, or preferred provider organizations. In a PPO plan, you have a network of doctors and hospitals. However, you can use out-of-network providers for services, being covered usually for a higher cost as well. Special needs plan, or called SNPs for short. These are Medicare special needs plans that are designed to provide focused care management, special expertise of the plan's providers, and benefits tailored to the enrollee conditions such as diabetes, end-stage renal disease, HIV or AIDS, chronic heart failure, dementia, just to name a few. And the last common type of plan is what's called a private fee-for-service, or PFFS plan. So in a PFFS plan, you can go to any Medicare-approved doctor, other healthcare provider, or hospital that accepts the plan's payment terms and agrees to treat you. So that's an important component of it. All people with Medicare have certain guaranteed rights and protections. You do have these rights and protections whether you're in original Medicare, in the Medicare Advantage plan, or other Medicare plan, have a Medicare drug plan, or a MediGap policy. The following basic rights are also guaranteed. So you have the right to get health care services that you need, to receive easy-to-understand information, and to have your personal Medicare information kept private. If you're in a Medicare health plan, in addition to the rights and protections being previously described, you also have the right to choose health care providers in the plan, to get a treatment plan from your doctor if you have a complex or serious medical condition. A treatment plan lets you directly see a specialist with the plan as many times as you or your doctor think you need to. Women have the right to go directly to a women's healthcare specialist within the plan without a referral for routine or preventive healthcare services. You also have the right to know how your doctors are paid if you ask your plan. Medicare doesn't allow a plan to pay doctors in a way that interferes with your getting needed care. You have the right to fair, efficient, and timely appeals process to resolve payment and coverage disputes with your plan. You also have the right to ask your plan to provide or pay for a service that you think should be covered, provided, or continued. So that's an important thing to remember there. You can also file a grievance about any concerns or problems that you have with your plan. For example, if you believe that your plan's hours of operation should be different, or there aren't enough specialists in the plan to meet your needs, those are some common scenarios. Obtaining a coverage decision or coverage information from your plan before getting a service to find out if it will be covered, or to get information about your coverage rules, is also one of your rights. Your plan must tell you all of these things if you ask. And of course, you have the right to privacy of your personal health information, as we mentioned before. All right. So as a reminder, the enrollment deadline will be here before you know it, and we urge you not to wait until the last minute. If you're not yet working with one of our friendly Medicare experts, simply call the main line toll-free at 1-866-323-1441, and your call will be routed to a licensed advisor that can assist you. From that point forward, you'll be able to communicate with that personal advisor via email or by phone whenever you have any questions at all about Medicare. You can also schedule an appointment directly in the advisor's calendar for a day and time that's convenient for you. And because it's our busiest time of the year, a number of those appointment slots have already been taken. So again, call the main line if you don't yet have an advisor that's been assigned to you. If you are currently working with us already, reach out to your advisor directly by phone, email, or by adding yourself to their calendar. We'll answer any and all of your questions, guide you in the right direction, and help you determine the best course of action for your situation. Keep in mind that we represent all of the top carriers and plans throughout the country, so we can help you find a plan that works best for you and your situation. And in each year, we'll conduct an annual comprehensive policy review to ensure that you're always kept in the best, highest value, lowest premium plan available. And best of all, we can do everything for you from start to finish at no cost to you. And that, ladies and gentlemen, concludes our presentation for today. We'll go ahead and open it up in case there are any questions out there. In the meantime, I'll go ahead and show one of our advisors many excellent testimonials. This is Tom Lockwood from a very satisfied client. So if there are any questions out there, I'll be happy to address those at this time. And that could be in regards to the presentation that we just covered as far as Medicare Advantage plans go, or Medicare in general, if there are any questions out there.
If they take a Medicare Advantage plan, every time you go to the doctor.
Well, I think the doctors, right? The hospital. I don't know.
Can't tell if that's a question or talking amongst yourselves. Okay. Well, I guess must have done a good job of addressing everything at this point. I don't hear any questions or see anything on the chat box currently. So we will go ahead. Once again, we want to thank you for taking the time out of your schedule to join us today. We'll go ahead and wrap it up here. We hope you got some value out of the presentation and hope you all have a wonderful evening. We'll look forward to talking with you real soon. Thanks, and bye for now.
I mean, we could.
Well, you have to look at each plan and ask what their geographic opinion is, right?
Well, that's what these